Hello, I'm Julia Walsh from Brand Medicine International, and I'm a search listening specialist in healthcare. Today, we're going to have a look at the real world questions that Australians are asking about the coronavirus vaccine rollout. So, a top theme that's coming up this week is, are vaccine companies liable for damages? There are a number of different queries being entered into search engines around this particular topic. For example, can vaccine manufacturers be sued? It is really important to understand the results that are coming up in response to these queries, because if people feel like there's no safety net around taking the vaccine, if they are impacted with the adverse events that are getting a very high profile in the media, then that might drive vaccine hesitancy and vaccine resistance. Another commonly asked question is vaccine without Medicare or without ID. I think it is really important to follow through this particular query and see the real world search results that are coming up in response to this, because where it's taking them, if you think about putting yourself in the shoes of this patient asking this question, it's taking them to a lot of search results that really talk about having a MyGov account, linking your Medicare card, making sure that your Medicare details are correct. There is a couple of responses here that give a hint of hope that there could be information relevant to answering this query, such as this one from health.gov.au. It talks about individuals without a Medicare, and you kind of go, okay, great, I'll click on that. If you think about this patient, it brings them to this page. Now, this page is really designed for providers, and it has reams and reams of information on every topic related to the vaccine rollout. So if you think about this patient just wanting to know, yes or no, can I get a vaccine for the coronavirus without a Medicare card? They're having to scroll through an enormous amount of information here to find the answer to their question. Eventually, way below the fold, they come across this statement here: patients who don't have a Medicare card. And it talks about the fact that the vaccine is free for all people living in Australia, and that they can be vaccinated as long as they meet the eligibility criteria. And it directs them to looking for clinics that are available to distribute that vaccine to them through the COVID-19 National Vaccination Information and Location Service. However, this is not a clickable link. So it begs the question, is this a website? Is this available in my area? And it's not really helping people who don't have a Medicare card understand whether or not they will be eligible and how they can access that vaccine. So we want to make sure that they can access this information easily so that they are not directed down some kind of rabbit hole. There was another link in that first page of results to this query about access without a Medicare card. However, it invited people to apply for a vaccine, and it did indicate that people who did not have a Medicare card would potentially be charged a $10 fee. Now, this is presenting a financial barrier to people without Medicare cards to access the vaccine, and it is important to kind of take that into consideration as to whether or not it might drive vaccine resistance. Another very commonly asked question at the moment is vaccine with fewest side effects. People are really looking to take into account their own research of comparing and contrasting the different available vaccines so that they feel they're making an informed judgment about their own personal risk. Now, this one is a really important one as well to follow through, because the search results for this illustrate that the narrative is really being left in the hands of the news outlets. There's no public health messaging on this page. And I think that that's really important to know, because this is where people are turning to and they're getting this kind of information. So we've got articles from Business Insider, we've got blog-like pages that talk on all kinds of topics, such as cats, and they're looking for clickbait. And obviously they have a really well-titled result here talking about which vaccine has the fewest side effects. We see from health.wa.gov.au information on a different type of vaccine. So it's not the COVID vaccine, but at the moment, when people are searching around vaccine online, they actually are meaning the COVID vaccine, because that's the hot topic of the moment. So that's not a relevant public health resource for the person undertaking this search. There is an overseas website which is seeking to consolidate a summary of the different levels of vaccine side effects, but it's not very patient friendly because it's more directed at people with high health literacy. So patients might end up stumbling across this article and click on this. And I think this is an important thing to understand about the patient information journey that's happening around this topic right now in Australia. It's bringing them to this page, and this is basically comparing and contrasting the experience of 3 individuals who took 3 different vaccines. So one who took the Johnson & Johnson vaccine, one who got the Pfizer-BioNTech vaccine, and one who got Moderna. And this article discusses and compares and contrasts their various results. So I think it's really important that we do know that this is what's happening out there, because this is the reality and these are the results that people are getting. And what's going to happen is they're going to drag these results into Twitter, or they're going to drag them into discussion groups on Facebook, and this is going to be amplified as well. So there is no evidence-based content or public health sponsored content answering this question online, but it's a very commonly asked question. So this is going to potentially drive hesitancy and also resistance to the taking of the vaccine. I also undertook a people also ask exercise. So this follows commonly asked questions and the correlated questions that people also ask into search engines when they ask that question. And I wanted to start with the query that is often seen: are vaccine side effects a good sign? Because that is something that's interesting to know, the conversation that people who are asking that question, what are their other questions? People are also wondering why you get side effects after the second COVID vaccine. And it could be deterring people from actually taking that follow-up vaccine. The results to that are really important. People are also asking, what should I do after receiving the COVID vaccine? That to me tells me that potentially there is more need for information as people are discharged from the vaccination centres to be provided information on. Some of the questions are, can I eat after I take the vaccine? A very commonly asked question in Australia is, can I drink? And particularly, can I drink alcohol? So we need to be providing people guidance on that, because they're, questioning whether or not that is going to impact the efficacy or exacerbate the side effects of that vaccination. There's also a question being entered into search engines around, can workers remove themselves from work if they believe it's not safe due to COVID-19? So this is something I think is really important for industry to acknowledge and to have those conversations with staff members and make sure that people aren't quietly turning to search engines seeking this advice because they're feeling too afraid to raise their concerns in the workplace and they feel like they're being put at risk. People are also seeking guidance in that workplace potentially of, can fans be safely used inside? They're wondering if the use of a fan is going to spread the virus more widely within an area, or is it potentially going to disperse the virus and decrease the risk of infection? So there are questions like that. And my final thing I'm going to share with you today is this question I thought was kind of interesting. Somebody has turned to a search engine and asked, are the dangers of smoking my water pipe during the coronavirus disease pandemic? And I just thought it was funny because it's such a full sentence. I don't often see such complete sentences. I do see long tail questions, but I don't see them being so specific as this. And I was like, what's a water pipe? And then I realized, and I kind of thought, oh, okay, well, at least I guess they're trying to smoke it safely and not share coronavirus. I'm not sure, but there you go. So anyway, thank you very much for joining me on this exploration of what people are asking search engines and what is their patient information experience in Australia around the topic of the vaccine rollout. If you have any more questions about it, please feel free to contact me here at Brand Medicine. I'm here to undertake search listening in any category. It's a definite passion of mine, and I think it provides unrivaled insights into the real world questions people have around a disease, a category, a therapy, and more importantly, identifying and diagnosing where they're stumbling across misinformation, because that way, if we know about it, we can do something to clean it up.